on our way to London, Paddington, on our way to the hotel. See you there. Hello, we are in our hotel room. It is Tuesday, and my surgery is on Thursday, roughly like 2 o'clock, I think it is. And then I'm in the morning for the endoscope. I've kind of mentioned you in videos before, but I don't think I've ever really shown you. And to give that context, we've been together like nearly 8 years now. We met pre my transition. I've been transitioning now for nearly 3 years. You've been with me the whole way. I'm at a stage now where I'm thinking like, oh, this is going to be some of my final words, my final moments with this set of vocal cords, or at least these vocal cords in the state they are now. And yeah, I don't know, what's going through your mind right now?
Just emotional, I guess.
Yeah.
Yeah.
Why?
Because this is who I've known you as for 7 years, so like it's all changing.
Yeah. I guess from my perspective, I'm just caught up in all the excitement of the benefits of it. Obviously, there's going to be negatives. I'm scared of that. I'm worried I'll never be able to sing again. I've kind of talked about that already. It honestly snuck up. I had a lot of work stuff going on. If you haven't watched it, go watch Good Boy on the RT player. Gotta get that plug in. So that really kept me busy, and this just super snuck up. And now I'm sitting in a hotel room 2 days before surgery. Going to see life tomorrow. It's gonna be awesome.
Some amazing creatures.
It's definitely turning the page on a new chapter. I think, at least. See you.
In sea life.
Yeah, see you in sea life. I guess I'll show you some fish. So it is time. It is 11:30, I guess. We are getting ready to go out the door and go have this surgery, I suppose. The clinic is like a 20-minute walk away. Excuse my face. I'm not allowed to have any makeup. I swapped out my piercing. For any of you, if you have Medusa piercings, Chadwin seems pretty okay with swapping it out for like a PTFE, like plastic one for the duration of the procedure. Similar with my nose, I'm just going to take that out when I get there. Same with my other ones. I didn't have to do that, by the way, with the helix. I can leave that in. It's just like ones I can easily take out. This is it. It's one of the last videos I'll ever record with my voice like this. How are you feeling?
Emotional, I'd say.
Emotional.
Excited.
Oh, me too. I just find myself thinking now a lot about, as I approach what my final words are going to be, so many different moments are becoming like, oh, this is my last time like singing in the shower. This is my last time doing this. This is my last time doing that. It's made me a bit like dramatic, but it's what you kind of, the headspace you go to.
They have a pharmacy here as well, so you can get a prescription.
Do that?
Yeah.
So, quick room tour. They've just brought me down. I need to put on all of this, and outer socks, compression socks, underwear, fantastic, so Gucci, and then like a gown and stuff. I got my own little bathroom, my bed, and yeah, the door. See you all on the other side. Can I get a fit check? Look at this. Grandpa core. Anyway, yeah.
Nice.
My name is Linda, the in-flight lead, and it's my pleasure to welcome you on board today. A special welcome to those of you.
Hello. I'm able to whisper pretty well. But as soon as I try to talk, it sounds like this. Well, that is pretty disappointing, to say the least. I don't know if I'm meant to try and just keep speaking. Wow, okay. Interesting. This is day 8 after my surgery. Kind of crazy. So this is day 8 or 9. As you can tell, still very raspy. But she's getting there, I think. Sounds a lot more high, I guess, than it did like 2 days ago. We're out taking photos. See you in a few days. Hello. So we are on day 11 now. I just thought it'd be fun to do it outside because it's a bit different from my desk. I was very worried at the start that I was basically getting no results, but I think you can kind of hear it now. It's getting up there now, and each day that goes by, it gets better and better and better. I found out that I had a bit of a cough immediately after the surgery. I know, like, great timing, but that can cause a lot of inflammation, and inflammation with already traumatized vocal cords, it leads to it being very hoarse like that, because I was very kind of disappointed when I heard that my day 7 results were so low, because I've seen videos of people who did their voice at day 7 and it was really, really high pitched, and I did not get that at all. If anything, it was deeper than my regular voice. I should probably not even be speaking as much as I am now. I'm on day 11. So it's meant to be like 15 words a day in the second week, and then you kind of build it up in the 3rd and 4th week. Definitely, this is a huge improvement. I'm starting to feel way better. If my voice never changed from how it is right now, I'd honestly be happy. I am not trying to raise my voice, and that's kind of something I had to get used to not doing, because every time I'd usually go to speak to people in public, I'd be like prepping my vocal cords to like try hit those higher notes. But yeah, I'm quite happy even with this. So I'm excited to see where it goes and goes from here. I think I sound like the doll deranged girl. The like, oh my God, we got like spooky chica and like special edition chica. And she's follow her on Instagram. She's really funny. But yeah, whenever I speak, I just constantly think of her. But which is amazing because she has an amazing voice. I'm getting very, very happy with how my voice sounds. Yeah, amazing. Hopefully the wind noise isn't too bad. But I just thought it'd be nice out in nature. I'm Irish. I'm in Ireland. I'm in the Garden of Ireland in Wicklow. So here's a hedge. But yeah, okay, see you. Bye. Okay, I'm going to make this quick because I'm fighting a minor panic right now. I just felt like a sharp pain in and around what feels like my vocal cord area. You can kind of hear a sound when I stop speaking in recent. No, maybe. I'm worried I've like torn a bit of my vocal cords where they were sewn up. I was admittedly singing or trying to sing when it happened. And then for a little period afterwards, I was able to hit higher notes than I had previously. I'm hoping it's nothing. I'm hoping it's just the stitch went or something, or it was just nothing. But yeah, it does hurt a little bit now when I speak, so I'm just gonna stop speaking now. But yeah, I'm a little scared. I hope it's okay. Bye. So I was just walking home after a day at work. I was doing night shifts. It's like 4:30 in the morning right now. And I've been speaking for, I'd say, like 12 hours straight. This is arguably the day I've spoken the most since post-op. And yeah, this is what my voice sounds like speaking after an entire work shift. I really like it. I I think it's really nice. Aside from the hoarseness, if that goes, even how it is now, I quite like it. All of that low end has just gone out of it. And now it's that like sexy femme fatale kind of voice. I love that. Oh, well, hello, my lovelies. It is the 12th of November now. This is how my voice is sounding. It's pretty similar to my pre-surgery voice. Although from examples that I've heard from other patients of Chadwin is that their voices would often sound pretty similar to, or they would express dissatisfaction with the fact that their voice sounded quite similar to their pre-surgery voice. And then 4 months later, they post a video and they just sound cis. So regardless, even with how I am now, I'm pretty happy with how it's going. I started a new job in the middle of all of this, and I'm pretty sure I'm passing with everyone, which is insane and something I've never really experienced before. And it's I love it. It's really interesting. And yeah, anyway, I will update you all more later on. Bye. Hello. Long time no see. It is the 29th of November. I'm maybe 6 weeks after my surgery. I have my check-in with Chadwin on the 10th of December. Please excuse my current face, but I had a bit of a, I want to say breakthrough, and I want to show you and document it. Hopefully I can still do it, but every once in a while I do something, an experiment with my voice, see how much I can push or like what I've regained in terms of use. Now you'll have to forgive me, my voice is a bit fucked at the moment because I've been probably overusing it, but I had a go at singing, and normally my voice kind of falls apart when I try to do that. It goes like kind of thing. But just being able to hold a note, I had kind of resigned myself to the fact that, oh, never gonna be able to really sing again. It's a pretty profound moment. I cannot stress enough how much of a quality of life improvement this surgery has been. It's yeah, I cannot put into words. But yeah, I will see you probably around when I go to Chadwin for my checkup. See you. Alrighty, fam, how are all of you? Hannah here, and we are now 8 weeks post-operation with Dr. Chadwin Ayagchi. I'm checking in. You can hear the difference in the update in my voice. I'm just home after work, so this may be an example of what it sounds like after I've been talking basically all day. So I just wanted to do a quick check-in video. Hope you're all good. Sorry, I look terrible. But yeah, I'll probably see you in the wrap-up video. Bye. So, I guess it is time for the wrap-up or the summary. I've got my phone here with some notes for things I want to cover. But yeah, it's currently January 8th, so we are 83 days after voice feminization surgery with Dr. Ayagchi. I still have a long way to go in terms of healing. This video, at least, needs to end sometime, and it feels like I've been recording it for forever. So, I'm also a tiny bit sick at the moment. I did think about postponing this and recording it a bit later, just to give a bit more of an accurate representation, but I don't think I have like a sick voice in this at all. And generally, when I think I sound sick, I usually end up just sounding normal anyway, so here we go. So I'll start with the recovery immediately after the procedure. So like day 1, honestly, pretty painless. Obviously your mileage may vary, but I literally walked out of the clinic or the hospital and then went shopping. So that was pretty amazing. That's when I got this ear cuff. I usually like to get tattoos or a piece of jewelry or something to kind of remind me of a procedure. So for instance, this tattoo, I got after my BA and my working. My cat is eating, so I'm gonna let him finish his thing. So overall, in terms of the rest of the recovery, pretty stressful, to be honest, like mentally. In terms of like physical discomfort and pain, didn't really feel any. It was more so the anxiety. I have to say, this is the most anxious recovery I've ever had. Constantly wondering like, oh, have I done something that's going to mess up the surgery? Or being unhappy with the results when you're literally a week post-op. The changes on the recovery happen so gradually that you really don't notice them. And for me, at least, it was very therapeutic going back and editing this video and seeing like days 11, 25, 30, things like that, and how much my voice changed, and I didn't really realize it, especially compared to how I am now. It makes me excited, I guess, for the future too. There was also the checkup. I really didn't get much footage when I went to do this. This happened maybe 2 weeks ago or so. Flew back to London, got an endoscope, and had a look at how everything was going. Sorry, my phone turned off. So to summarize, the healing couldn't be going better. The sutures are still in there. I was convinced that they were gone. Like, I didn't really get a timeline for when they were gonna disappear, I guess, because they're like self-absorbing sutures, but apparently they're still intact. So I'd assume once they're gone, I will kind of see a difference as well. I did ask, like, oh, is this it now? Or am I going to expect more changes over the recovery? Because Dr. Aliagchi does describe the recovery as taking up to 6 months. And he's like, oh, yeah. Things I can expect is improvements in like volume, stability, and clarity. So I'm excited to see that. Another thing I want to touch on, I guess, is the experience with Dr. Aliagchi and One Welbeck Clinic. All I can say is him and his team are incredible, best in class. And I've had other surgeries, notably with, I guess, like facial team, they'd be a pretty good comparison. And he is right up there. He is in for the long haul too, in terms of these trans surgeries. He is one of like the world authorities on procedures like this. And I feel grateful to have been one of his patients and to still be, I guess. The waiting room is also kind of a vibe. Both times I was there was 2 or 3 other trans girlies there, and God, y'all slay. That's kind of nice to see as well. Like, you're not the one person turning up at this clinic, that the one trans person, sorry, like once in a month, where you're like, ugh, like the one kind of thing. Now they're doing this on the daily, and it is very much like their bread and butter thing. They do a lot. At least I could be wrong. That's just what it looks like from my perspective. Next, I want to cover learning to kind of work through the mental blocks of confidence when speaking. I've written here, I spent so much of my time pre-surgery avoiding speaking. And if I did, I'd speak as little as possible, or I'd speak quietly, things like that. But after this procedure, I've noticed that, oh, if I go into a sentence without like projecting properly or projecting strongly, it ends up sounding worse. It's kind of working against me now, and a lot of people talk about this, especially if you've had voice training, which Dr. Aliagchi does require you to have had voice training, at least as far as I'm aware, before he'll perform this procedure. So you have to undo a lot of the kind of muscle memory and mental memory of speaking that you've kind of built up through doing voice training. And it's also kind of unlocked a lot of freedom, and maybe I'll touch on this later. Like replying to Siri in public is something I'd never do, but now I'm like, yeah, hell yeah, Siri, read me that notification. Because saying that one word is something I didn't really want to take the chance on, particularly in public and in public transport and things like that. Did it affect anything besides my voice? So I'm thinking things like sneezing, coughing, laughing, maybe some other sounds. And I'm happy to say yes. I distinctly remember when I was researching this procedure, people said it didn't. But in my experience, it did. My sneeze in particular, it's super girly. It's real cute, I think, at least if I may say so myself. But Kaylee, my wife, has also said my laugh has changed a lot. Next is tips for anyone kind of thinking about this surgery. I'll start with maybe things to consider. Is you're going to lose volume and clarity, for sure. At least volume. In the long run, if that's something that's going to affect you, maybe you work in like a nightclub, in a loud venue where you have to constantly raise your voice, you're going to have difficulty. I still have difficulty 2 months on. I had like an old work party and I had a wedding. The wedding was closer to the time I finished the procedure. So I literally ended up going back to my notes app and just showing people messages, because there was not a hope in hell I was going to even be physically able to raise my voice high enough to be heard, let alone heard in a feminine way. So I managed, but just keep that in mind. If you do like a lot of work presentations, you're going to be out of action for a bit. Another tip is take the recovery seriously. This is one of those procedures where there is a failure rate. Obviously, there's a failure rate with every procedure. I believe with this, it's about 90% success. So there's that 10% failure rate, and or like dissatisfaction. I'm reluctant to use the word failure, I guess. How well you stick to the recovery affects how you get your result. Another is look at your phone's operating system for accessibility features like text-to-speech. I've really struggled to find an app that did that well, and I'm assuming now it's because phones, in my case I was using an iPhone at the time, they have very good built-in options. And then last thing I'd say is really consider if you need it. Do voice training first. Like I said, Dr. Ali, actually, I'm fairly certain, requires it beforehand, but you can get very far with voice training, and a lot of people will not need or feel the need for a procedure like this. A lot of people, I think, would argue that maybe I didn't, but in terms of the mental blocks that my voice put on me, I personally still felt that I needed it. Next is the conclusion. Am I happy? Honestly, you can probably tell from the later clips in the video, I couldn't be happier. This has been a huge quality of life improvement. I mentioned earlier, being able to reply with like a text message or a voice message or answer Siri in public without having that niggling thought in the back of your head is incredible, and it's life-changing. And it really highlighted for me how much my voice had stunted me previously, and it's been a huge confidence boost. In terms of what's next for me, I do want to do some voice training. One thing I find with my voice now is it's very inconsistent. I feel like I have 3-4 different voices as the day goes on. Like I'll sit up, get a glass of water, take a sip, and suddenly I have a different voice. And things like that. Like I take a bite of chocolate and voice is different. I've recorded this like 2 or 3 times, and I'd say my voice sounds different in all of them. So I do want to work on that consistency. One thing I find with this procedure that's very interesting, and I've described it to people as, it's like you've had a guitar your entire life, and now someone has swapped it for like a violin or a piano. There's things you're used to doing with your old instrument that don't work, or maybe they do something else on this new instrument. And then there's entire aspects that you never knew you even could do because it's a different instrument. And that has been very interesting. Like I'd find like or make it sound like that before would make a completely different noise. But now it makes a wildly different noise. Or I just find that I can make a sound that I previously couldn't. And then I kind of explore that area of usability, I guess, and that range. And then of course the inverse is true. Stuff you could do previously, you no longer can. And one thing I find interesting, if I try to do like a deeper voice, it just sounds like a higher pitched person trying to do a deep voice. So it's like, oh, hello, my name is, I am the big grunt from this movie. It sounds different to how, like, doing a deeper voice procedure. Another thing I want to mention is, I guess, longevity of your voice. So I'm having a rough time right now, and I've been recording for nearly 15 minutes. I did a test recording for 10 minutes earlier, and you can really feel it in your throat. Like you get vocally tired quite quickly. Now, lastly, I want to speak to how this has affected my transition as a whole. This really feels like I've written here, like one of the final bricks in the wall, or like the final points in my transition. And it's reminded me of the fact that a transition is just that. It's a process with somewhat of an end. Now, I don't believe a transition really truly ends. I think we're always kind of changing or transitioning, I guess. This has kind of reminded me of that light at the end of the tunnel. If you're a trans person, you know that being trans can kind of be all-consuming. It can work its way into every aspect of your life, and it comes up everywhere. And this, like I said, has kind of allowed me to kind of reel that in and leave that a bit behind and kind of just get on with living and get on with my life. That kind of transness aspect of it can kind of take a step back and kind of move out of the way and allow me to just be a person, which has been amazing and something I am truly grateful for. So, I guess we will leave it here. Thank you so much for sticking with me through this long video. I hope it was interesting. And please, if you have any questions, I know I kind of struggled to find in-depth information about this procedure. If there's any way I can help, any questions I can answer, feel free to reach out to me, leave a comment, message me, whatever, and I'll do my best. I also have a second video in the works. That was I recorded it before the procedure, and it was my reasoning, I guess, of getting it. So if that's of interest, let me know. Anyway, I hope you'll all have an amazing rest of your day or evening. Yeah, thanks. Bye. Cool.